Hi, good morning everyone. Today we are going to discuss regarding assessment of newborns. If you are coming to the assessment of newborns, we will assess the newborns in four steps: initial assessment, transitional assessment, gestational assessment, and systemic assessment. If you are coming to the initial assessment is nothing but mainly we are going to see APGAR score. What is this APGAR score? APGAR score is it's a most frequently used method to assess the newborn's immediate adjustment to the extrauterine life. Means when the newborn's born, immediately we are assessing how capability of the newborns to adjust for extrauterine life. Before they are in mother womb, now they are coming out of the mother womb. So how they have the capability to adjust extrauterine life. The APGAR scoring system, we are give score based on heart rate, respiratory effect, muscle tone, reflex or irritability and color of the newborns. What are the uses of APGAR score? It helps to assess brain function at birth. It helps to assess circulatory status of at birth. It helps to assess the effectiveness of respiratory and circulatory adaptation after birth, and it helps to know regarding which babies needs active assistance like CPR, resuscitation. What are the purpose of APGAR score then? The purpose of APGAR score, it used to evaluate baby condition at the birth. It helps to determine the need of resuscitation. It helps to evaluate the effectiveness of resuscitative efforts. It helps to identify neonates at risk for morbidity and mortality. This is the APGAR score system. For example, you can see one side we have 0, 1, 2 score. If you are coming to the appearance, if baby body full blue color, we can give score 0. If baby extremities in blue color, we will give score 1. If baby there is no blue coloration on all over body, we will give score 2. Next, if you are coming to the pulse, absence of pulse 0, less than 100 beats per minute 1, more than 100 beats per minute score 2. Next, if you are coming to the grimace, the facial response or the response of the baby, no response to stimulation. For example, if you are poking or pricking, there is no response to any out stimulus 0. If while you're pinching, if the baby face changed for grimace, we will give score 1. If baby start to cry, we will give score 2. Next activities, there is no movement of extremities, we will give 0. Somehow flexion, that we will give 1. And flexion of limbs that can resist extension, we will give score 2. And if you are coming to the respiration, no respiration score 0. Weak respiration, score 1. Strong cry, we will give score 2. So at the end, appearance, pulse, grimacy, activity, response. What are the score you given? For example, appearance we given 1, pulse we given 1, grimacy we given 2, and activity we given 2. Then respiration we given 2. If at end we are adding 0, 1 plus 1 2, 2 plus 2 4, 4 plus 2 plus 1 3, 3 plus 2 5, 5 plus 2 7. 7 means 7 to health, 7 to 10 we will call them healthy newborn. If Apgar score 7 to 10 we will call them healthy newborn. If the score between 3 to 6, moderately depressed newborn, so they need resuscitation. And severely depressed newborn 1 to 3, they will give intensive resuscitation, like intensive care with resuscitation. This is significance of Apgar score. Once again, we will discuss what is Apgar score. Apgar score, it's a most frequent method we are used to assess the immediate adjustment of newborns to the extrauterine life. So the Apgar score, in Apgar score system, score we are giving based on observation like appearance, heart rate, respiration, muscle tone, reflex. Next, what are the uses of Apgar score? Apgar score is used to evaluate the brain function of newborns at the birth, circulatory status of newborn at the birth, and to evaluate effectiveness of respiratory and circulatory adaptation after birth, and it helps to evaluate if any baby needs any resuscitation. This is uses. And purpose and uses almost the same, like to evaluate condition of the baby at birth, to determine need of resuscitation, and to identify risk of morbidity and mortality of neonates. Next, this is the scoring system. Already I told Apgar score, we are giving score based on baby appearance, pulse, muscle tone like activity, grimacy like response, and respiration. First, you're coming to the appearance. If you're seeing baby appearance, all over blue color, score will 0. Only extremities blue color, score 1. There is no bluish discoloration all over body, score 2. If baby pulse absence, 0. If baby have less than 100 heartbeat, score 1. If baby have heartbeat more than 100, score 2. Then if baby having no response, if you pinch baby, if there is no response, score 0. While pinching, if baby facial changes will be there, like grimace on stimulation, score 1. If you're pinching, baby will cry, score 2. Then if you're coming to the active, there is no movement, extremities are rested, score 0. Some flexion in the extremities, score 1. And flexed limbs that resist extension means one side of the limbs is flexed, one side of the extremities is flexed, and another one side is extension. We will give score 2. Next, respiration, no respiration, 0. Weak and irregular respiration, score 1. Strong cry, score 2. This is regarding Apgar scoring. If you are coming to the significance of Apgar score, we will classify babies based on Apgar score rate, like healthy newborns. If the Apgar score is 7 to 10, in Apgar score we are checking immediately after birth and after 5 minutes after birth. So in the two times also health, if the Apgar score is 7 to 10, they're healthy. Yes. If Apgar score 3 to 6, moderately depressed newborn, they need resuscitation. If Apgar score 1 to 3, severely depressed newborn, so they need intensive care with resuscitation. This is regarding Hapgar score. This is initial assessment. Next, if you're coming to the transitional assessment, the transitional assessment is it's nothing but periods of reactivity. So the periods of reactivity will divide into first period of reactivity and second period of reactivity. If you're coming to the first period of reactivity, the first period of reactivity will take place during first 30 minutes of the newborn after birth. Like in the first 30 minutes, the newborn is very alert, cries vigorously, and may have may suck a first greedy and appearance very interested in the environment. And their heartbeat or respiration also will be changed. The respiration rate will be 80 breaths per minute, and heart rate may reach 180 beats. And their bowel sounds are very active, and there may be mucus secretion will be there, and temperature may decrease slightly. This is first period of reactivity means transitional assessment. And transitional assessment, it's mainly we will assess this based on period of reactivity. The period of reactivity classified into first period of reactivity and second period of reactivity. First period of reactivity during first 30 minutes to it lasts for 2 to 4 hours. So first 30 minutes the newborns is look very alert, cries vigorously. They may search for sucking something, suck for greedy, they're greedy to suck, and their appearance very interest. And physiologically, their heart rate will be 180 beats per minute, and their respiration is also higher than 80, and they have active bowel movement and increased mucus secretions, and temperature may slightly decreased. And it's I told the first period of reactivity lasts for 2 to 4 hours. So in that time, at the end of 2 to 4 hours, the heart rate and respiration rate may be decreased, and temperature will continuously it may fall, decrease, and mucus production will decrease, and urine and stool is usually not passed, and the newborn is in state of sleep and relative calm. Next, second period of reactivity. Second period of reactivity will start after 4 hours and it lasts for